Okay, we're back. This is the second in a series of a couple of practice questions for you. These are NCLEX-style practice questions on depressive disorders. I covered depressive disorders content the other day, so these go along with that content that I covered. All right, let's start with the question. The nurse should frequently assess a client with a depressive disorder for lethality risk related to suicidal ideation. Which questions should the nurse include? This is a select all that apply. Okay, so I'll read the answer choices. A, are you thinking about hurting yourself or someone else? B, can you tell me your feelings about dying? C, where do you keep your gun? D, have you told your psychiatrist you feel like dying? And E, have you thought about how you would hurt yourself? Okay, I'll give you a couple of minutes to think about this one, and we'll come back. I'll talk about the correct answer and the other answer choices. Okay, we're back. All right, the correct answers on this one. Now, don't forget, select all that apply. You have to take each answer choice and treat it like a true-false question. Take letter A, B, C, D, and E, answer choice, and ask yourself, is this a true answer for the question? Let's read the question again. The nurse should frequently assess a client with a depressive disorder for lethality risk related to suicidal ideation. Which questions should the nurse include? And you're always looking for priority. The nurse can ask any of these questions, of course, for the client, but the key here is to find the priority questions. And the key words in the stem of the question are lethality risk related to suicidal ideation, because the lethality risk is going to determine the is it a high risk of the client committing suicide. Okay, lethality would be like, for example, using a weapon on yourself as opposed to taking pills. Okay, more lethal, in other words. Okay, so the correct answers are A, C, and E. A, are you thinking about hurting yourself or someone else? Yes, this is correct. The nurse is going to ask the client directly, have you thought about killing yourself, or have you thought about harming yourself in any way? If so, what do you plan to do? Do you have means to carry out the plan, or how strong are your intentions to die? The risk of suicide is greatly increased if the client has developed a specific plan on how to carry it out and has strong intentions, and especially if they have means to execute the plan. In other words, do they have access to weapons? Okay, so letter A is correct. Letter C, where do you keep your gun? That has to do with lethality. That has to do with, do you have access to weapons? If the person is in a mental health facility and they're expressing suicidal thoughts, they obviously don't have access to weapons. So the lethality is automatically lower. But these questions should still be asked of the client. For example, once you're discharged and you go back home, do you have access to weapons? Okay, and letter E is correct. Have you thought about how you would hurt yourself? Is there a specific plan? Can you tell me what the plan is? Have you thought about it? How would you do it? How would you carry it out? And what weapons would you use? Do you have access to those? Okay. Let's look at the other answer choices. Can you tell me your feelings about dying? That's an important question, but when you have a client with suicidal ideation or suicidal thoughts, that is not a priority questions. Later on in therapy, you can ask that client something once they are past the risk. Letter D, have you told your psychiatrist you feel like dying? It's another important question, but it's not the priority. So the priority is to determine the lethality. How lethal is the risk? How serious is the person about it? Are they just having fleeting thoughts? Or do they have a specific plan? Do you have a plan on how to carry out this suicidal act? Okay, and then do you have the means to carry it out? Okay, that's it for this one. Hope you enjoyed it. Talk to you soon.